Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
And welcome to another episode of What the Health. I am Dr. Dan here with my co-host,
Angela. Welcome back, everyone. As you know, I'll get this out of the way. We are here for informational purposes only, in no way offering individualized medical advice. As always, talk to your trusted healthcare provider before making changes to your life or routine. So with that being said, I know this is a big one for you. This is something that's been...
I'm seeing it more and more often. So we're going to talk about instability inquiries, or more in relationship to ligament instability. And a lot of it's a big buzzword that's coming out in the healthcare field. I would say probably over the last decade or more. But we're seeing...
And even just recently, I've just noticed more people coming in and using that word, which is not...
Yeah, like they know about it.
Yeah, which is not something that, I noticed as much earlier on when I started with you guys.
Yeah, so if you just, do a search on, ligament instability, you'll see a lot of... you'll probably see videos of motion x-rays come up, which is a good thing because that is the gold standard for analyzing, spinal motion. But I think what the challenge becomes, you're looking for instability. Really what happens is ligaments, as your spine goes through a development and it hits that spinal maturity, which happens at about the age of 24, 25 years old. Women are usually a little bit sooner than men, but it's somewhere in that early 20 range that your spine hits maturity, and really your whole skeletal system hits maturity. So meaning that all the growth centers of the bones have closed up.
You are done growing.
Yes, you're done growing. So bones have stopped growing, and then the ligaments have reached a healthy tension, hopefully a healthy tension around.
And for those who don't know, the ligaments are what connect bone to the bone. So they help hold everything. Like your skeleton would, without all the ligaments and tendons and muscle and everything.
Yeah, it would just fall apart.
It would just be,
Yeah, you think
about Halloween skeleton. We had Halloween coming up. Like how they're all like, wee!
Yeah. There's a big dinosaur, Tyrannosaurus Rex skeleton in the Pittsburgh airport when you're going up, going down. But again, it's all held together by wires because,
the bones can't just stay in place.
So you would just be a big, flop on the floor if you didn't have ligaments holding the bones together. And then you have tendons, which connect muscle to bone. That's what allows the lever action of the movement of your body, left, right, side, twisting, looking left, right. So
quick anatomy lesson for those, since we're going to be sitting here talking about, I don't want people sitting there going the whole time like, what the heck is a ligament? I don't know.
Do I have one? Do I have a ligament? Do I need to be concerned about
Yes, you all have ligaments.
Everyone has ligaments. So there's this big buzzword, and and some of it I think is related around. There's a syndrome called Ehlers-Danlos syndrome, and that it used to be there was when I was learning it in school a little over a decade ago, talked a lot about like there was a genetic component to it, but more and more that Ehlers-Danlos has been discussed over the last several years. It more is becoming a syndrome that doesn't necessarily, it can have a genetic component, but just like with a lot of these other disorders where they don't really truly understand the mechanisms behind it, there can be genetic markers, but there's some cases that there's no genetic marker, but you have all the symptoms of the syndrome, kind of like fibromyalgia, right?
Yeah,
there's like literally fibromyalgia is such a broad-based
term. It's like we know something's wrong.
We know something's wrong.
We don't really know what's wrong.
As the drug commercials say, you have hyperactive nerves, and it causes you pain.
Yeah,
so we're going to call it fibromyalgia.
Yes, we acknowledge here that you're in pain, but we don't know why.
We don't know why, exactly. So we are starting to see more and more, patients that are referred to us from other doctors who work with chronic pain patients that, maybe don't necessarily have a specific solution, or they're trying to look at multiple aspects. So I think that's where I really, started coming across this over the last several years, is that we started getting referrals because of the specific motion X-ray technology we have. It's called video fluoroscopy, or, dynamic motion X-ray, digital motion X-ray. So if you are having chronic pain and you don't know why, if your regular traditional medical doctor, doesn't necessarily know, a great place to start, is looking at these motion X-rays. The challenge is a lot of patients are coming in and they believe, or, they have been told from, their primary care provider or another practitioner that they have this instability, or at least they want to rule out this instability. And really what happens is, your ligaments were kind of hyperstretched, and in an unstable or unstable ligament, hypermobile ligament, what happens is it was just stretched too far. If you think about it in terms of a t-shirt or a piece of a cloth, imagine, let's say, I have my younger sister here, and she's trying to run away from me as a young kid, and I just grab her t-shirt and rip her back, so that
I'm
she
sure
can't
that
get
never
away.
happened.
I'm sure
he's not pulling from an actual memory here.
So, and I rip her back, and, and now her t-shirt, you have this little bit of a wave in the t-shirt, right? Because you hyper stretched all the fibers in that t-shirt. And so now the normal tension on the t-shirt has been changed. And so now you have this waviness in it because it's been hyper stretched. That's what happens to ligaments that have been hyper stretched.
So example that comes to mind for me then is when I dislocated my shoulder. Yeah. So I sat in the ER with it dislocated for 4 hours. So for 4 hours, basically my shoulder was only being held in place by all those ligaments yes. because the bone was not where it was supposed to be, and they were getting stretched. So once it was put back in place, I was told, there's a very high chance that this could happen again, especially early on. They said if you can make it 3 months, great. 6 months, even better. If you can make it a year without it dislocating again,
that's a good sign.
Yeah, that's a really good sign, which I did because I followed PT and I followed everything. But I remember, I'd be walking around and in those early months, even just taking a shower, washing my hair, and it just felt unstable.
Loose,
yeah, it just didn't feel
it wasn't going to stay there if you lifted it anymore.
Yeah, and so that's what I always think of. So then people is that essentially what that would kind of feel like then if you did have that in the ligaments surrounding the spine? You would almost feel this slipping.
Well, yes. And the short answer is yes. We have patients that have that, feeling of if they just turn a certain way, it's going to catch, or it's just going to, their neck or their upper, because a lot of times they're looking at instability with the upper cervical area. And so in that upper cervical area, you have your occiput, which is the base of the skull. That's where your spinal cord leaves from the brain and goes, down through the spinal column. But you have your occiput, which sits on C1. That's the first bone, also called your atlas. And then C1 sits on C2. I'll never forget my anatomy teacher.
All these?
I'll never forget my anatomy teacher, telling us that you have to know all 24 names of every bone in the spine. Whenever she first introduced, the spinal anatomy that we were doing. And she's like, okay, so get it out because this is going to be on the test. C1 through C7. Those are the bones of the neck. T1 through T12. Those are the bones of the thoracic. L1 through L5. Those are the bones of the lumbar, the low back. Okay, great. Got it. Thank you. So you have C1, C2, and then, your head sits on top of C1, C2. So when we're looking at instability, because of the very close, intimate relationship of that, massive highway of brainstem turning into the spinal cord happens right through that area. If you have excessive motion in that area, you can have a lot of chronic weird symptoms that are associated with that. You could get, headaches, migraines. You could get, paresthesia, where you're having like this hypersensitivity, in the skin, like the tingling and numbness in the face or the hair, back of the neck. Dizziness, vertigo can come from, instabilities up there. I just mentioned headaches and chronic migraines. Tension in the musculature, where you feel like your muscles are just cramping down on you.
I'm assuming because they're overcompensating for the
that's exactly
ligaments
right.
not doing what they're
so the
supposed
ligaments aren't working, so now you're getting this excessive motion. Well,
your muscles are trying to keep you in place.
Motion is detected by joints and muscles. There's things called Golgi tendon organs, which those are sensor receptors in the tendons of the muscle. And then there's also muscle spindles, which are in the belly of the muscle. So those receptors are constantly, the tension on those receptors are in a constant feedback loop with the brain. So if there's too much or too little tension on those muscles, then there's feedback loops to either say, hey, take some tension off, or maybe you need to add more tension. So if you have ligaments that are unstable, and essentially hypermobile, and you have too much motion in one area, well, then there's going to be more motion in the musculature to the point where the muscles may start stretching too much. And so that feedback loop will then go up to the brain, and then the brain will say, hey, we need to tighten up those muscles. And so now you'll get muscle tension in and around the neck and the upper back, if that's the area that you have instability in. And, and again, instability going to like where in the region it happens. Well, because of our heads being a pretty heavy structure on a small neck. You have a large head on a small neck, especially when you're developing. We talked a lot about this. We just had a seminar, and we were talking about this. Doctors came from all over the country. We had about 15 doctors, and a couple from out west, a couple from down south. I mean, from all over the country. And again, we look at this stuff and we study this stuff. And when we look at the developing spine, when you're very young, infant, toddler stage, you have a very heavy head on a very small neck because, again, your spine is still developing. The ligaments are growing, the bones are developing, the muscle tension is developing, but that head is very heavy on top of the neck. And so now, let's say, for an example, you have a young hockey player who's learning how to skate. Well, they have to wear helmets. And so now you have this heavy helmet. You have this extra weight on this big head on this small neck. And so we were actually looking at cases where we could see either instabilities or changes in bone growth in that upper cervical area that very well could have been an excess of biomechanical stress or weight, stress and strain on the developing spine from a very young age. So these are all things that we can see. And so then you add in things like, contact sports when you're young and developing. Again, that spine doesn't hit full maturation until about 20 to 24 years of age. So if you're doing a contact sport, such as, the headers in soccer, Ethan finally, I just noticed the other day, he had his first game in a new, league. They're up another age group, and they were doing, a couple kids were doing headers. I'm like, oh, I guess they're allowed to do that now because they weren't allowed to do it the year before. So, again, something like that. Football, they're playing football. They still hit, even though they're trying to teach them better ways of tackling. It's still, you're hitting that head into someone else or into the ball. So it's a lot. You already have a large head on top of a small developing neck, and you add, another structure like a helmet or, again, a fast, start-stop motion in a sport that can significantly impact the structure of the developing spine. So again, when we're looking at these things like instability, we will see there's different patterns in the motions that we see that show excessive motion. And that could have a significant impact on, just some of the symptoms like I mentioned. So, how it develops, again, I think there's still a lot of unknowns in the literature currently. We're starting to, I think a lot of chiropractors who are very biomechanically and scientifically sound, they're looking at it more and more. And it's funny because a lot of what the chiropractors are seeing or have been seeing the last several decades who look at this stuff, they're starting to correlate with a lot of what we see in like neurosurgery journals and stuff like that. So there's a lot of cross-referencing in terms of the biomechanics of what the ideal spine should look like versus
what it's actually doing.
Versus what it's actually doing. So you really don't know if you have instability. If you have a chronic health condition, chronic pain or just, weird symptoms, a lot of times it'll show up after an injury. It maybe immediately, maybe years after. I know we had a couple patients that were in, pretty severe head injuries, and they have not been the same since those injuries. One of them was a hit to the top of the head. Another one was a fall off of a forklift and smacked his head on the cement first, and then his back and butt followed. But So yeah, I mean, a lot of times, if you have an injury like that and you are just not the same, after that injury, that is a case where you should absolutely look at a motion X-ray assessment, to see if there's any, instability there. But there's some people that, they just have these chronic conditions, like a fibromyalgia or just a muscle tension or a headache that just cannot, it doesn't respond to traditional, medications. Their traditional medical doctor can't figure it out. There's a lot of chronic pain clinics and all they want to do are, cortisone injections or, something that just traditional medicine is not helping with. It would be very beneficial to look at how the spine is moving because we can see if there are these instabilities that are leading to, that are leading to some of the chronic health conditions that you're experiencing. But one of the things, so again, the advantage that I have from the chiropractic perspective is, chiropractors are looking at structure and motion from the other end of the spectrum, from the restrictive end. So the spine could be moving too much, hypermobility, that would be the ligament instability, or it could not be moving enough. And that's where we call it intervertebral, between two segments of the spine. Intervertebral restriction, or the term we utilize commonly is subluxation, vertebral subluxation complex. So if the spine is not moving enough, then that is something that if it's locked up in one area, you change the tension of the entire system. So I always, I talk to my patients when they walk in, someone comes in with low back pain, just started a new patient the other day, he has low back pain. Well, guess what? I'm going to look at the lower back, but I'm also going to look at the neck because the spine works as a system. And if you have a lock or a tension, a subluxation in the neck, that changes the entire structure, the kinetics, the motion of the spine from top to bottom and bottom up. Think of it like this. If you've got, what's that cradle thing called? I always forget. Where the balls on the ends?
The metal balls.
Yeah, the Newton's cradle? Is it Newton's cradle? I don't know. Anyway, yeah, you got the metal balls and you got 5 of them. So there's 3 in the middle, and then you pick the one metal ball up and you let it go and it hits the 3 in the middle and then it sends the other one up and then it comes back. And once you get it in motion, it will continue to do that forever until you add a force or change the tension of there. So if I go and grab the middle ball, in that system, that's going to change the tension, the kinetics on there.
It's not going to let it transfer.
It's not going to let it transfer through. And so now it'll eventually slow down and stop. So imagine that for the spine. The spine is...
The subluxation is like somebody grabbing that.
Exactly. That's exactly right. The subluxation is like grabbing that middle ball. So you're changing the tension. So now you could have a lock in one area, but it's changing the tension on the ligaments and the musculature in a different area of the spine. Well, if then you go and, try and lift something up, or, you're trying to do some sort of activity, like a soccer ball kick, you're playing with your kids and you're trying to kick a soccer ball and, you're twisting the lower spine and the neck's been locked up for years and you haven't noticed it because maybe you injured it when you were young and you recovered quickly and, no pain associated with it. But now the low back locks up because you were being a weekend warrior trying to do too much and, oh crap, I can't get out of bed. I can't get off my couch. We all know those situations. Either we've had them ourselves or we know someone, a husband or wife or, a friend who was in that situation. So if the neck was locked up, changing the tension, of where the motion can move in the spine. So now you can see how you could have an increased stress on, the musculature and the ligament, soft tissue structure around the spine in a different area. And so that's where the pain can show up. Well, even though the pain is down below, it could be there because your body was not able to process the motion from top down or from bottom up. And so now all of a sudden you have an acute injury or an acute pain in one area, but the lock, the tension is coming from another area. It's the concept of the barking dog. I always use this example. If you step on a dog's tail, and he starts to bark, well, is the problem that he's barking? You can muzzle him. Or is the problem that your foot's on his tail? So muzzling the dog would be like taking a medication, doing an injection, trying to muzzle the area where it hurts, where you're in pain. Or you can take the pressure off of the area that's locked up or off of the dog's tail and he'll probably stop barking. That's the idea that we see all the time, is that if you take the pressure off the area under the most tension, then you will start to see the barking, the pains, the chronic, whether it's acute or chronic pain, you'll start to see those subside. Sometimes it happens immediately. Sometimes it takes time, especially if it's been there for a long period of time. It can take, months or years to fully resolve. But, again, it has everything to do with how long it's been there. So I think having that eye for someone who's looking at both the hypermobility of the spine, where it's moving too much, versus hypomobility, restriction, the subluxation. If we're looking at both of those in combination, what we can do then to impact there is, we can adjust, we can add motion to the segment that's restricted at the subluxation. That's what the chiropractor does. And many times, if there are instabilities, even if they're minimal or moderate, we'll see improvements on those instabilities when we unlock the area of tension. Because when you think about an area of, if it's hypermobile, if it's moving too much, but it's right next to an area that's locked up, does it make sense that the spine is trying to make up motion where it's been lost? So the segments above and below that are going to try and make up for that motion. So they'll look like they're moving too much. The ligaments are under more stress. The muscles are under more stress. So if you unlock the area of tension, then those ligament instabilities will start to resolve on their own, because now the spine is moving more fluidly through the system. You take the pressure off the ball, like in that cradle example.
And that's why the motion x-ray is so important, because that's the only way you would see that. I mean, you can take a still x-ray, which we do both, because that seeing the structure has so much value as well.
Absolutely.
But, we've seen people that have a nice looking curve in their neck, and then as soon as they go to move, you're like, oh, that's just not moving
the way it should. Absolutely.
So it's really important to have both, because that can really that shows the full picture. Then what does it look like structurally, but also how is it moving? Because that's how we've been able to help so many people that have been to so many other medical professionals and chiropractors and just not getting the relief. And I still think about the the woman that jumped off the table, one adjustment, and was like, my pain's gone. That was still, she was a sister. I still believe there might have been a little bit of other
spiritual intervention.
But she had been to, she was at the point of meeting with surgeons. It was, so because again, just being able to do that, do those x-rays and see. And it's about, again, it's about looking at things
from a different perspective, a more in-depth perspective, Unfortunately, something like a medication, it's a very shotgun approach, right? I'm just going to, take my shotgun and I'm just going to blast, all the way across and just, take 10 shots or whatever. Chances are I may hit my target.
Yeah, great.
But what damage have I done in the process? Whereas, again, I think we take much more of a sniper approach. I'm looking, I've got a laser focus on exactly where the instability, or really where the vertebral subluxation valve, the restriction in the spine, is located. And now let me go and target that and do the adjustment. And that's where you just have these massive people who have been to other chiropractors, who have been to other healthcare professionals, and are just not getting resolution in their pain, not getting resolution in their headaches, not getting resolution from an old injury.
Yeah.
They start to see that their body gets stronger. Again, sometimes it's very quick, sometimes it's over time, but they're seeing a result that they had not seen before because it's a much more targeted sniper approach, not the shotgun approach that medication has. Again, medication has a time and a place. If you've got like a massive presentation and you got to function, I get it. But again, it's not going to resolve the issue. Pain medication is merely masking, an injury of what's going on, the body signal. Pain is there for a reason. You put your hand on a hot stove, you better have pain, otherwise you're going to have damage to your flesh because you're not going to take your hand away quickly enough before it burns. So pain is there for a reason. Our goal is not to cover it up. Our goal is to get to the underlying reason why it's there. And, the motion x-ray assessment does such it's the gold standard. It's just, once you train doctors on how to use or how to analyze a motion x-ray, the reliability, it's something called in research, there's something called inter-examiner reliability and intra-examiner reliability, meaning that inter-examiner reliability means if you take a test and 5 different doctors do that test, they're going to come to the same conclusion with that test. That's a very high inter-examiner reliability. Yeah. If 5 different doctors do the same test and they come up with 5 different solutions, 5 different answers, that's a very poor inter-examiner reliability. So the higher agreeableness you have doing a test between different doctors, then the higher again, the higher inter-examiner reliability, the better the test is. So once you train doctors into how to look for these restrictions and hypermobilities, then the agreement between these doctors gets in excess of 90 to 95%. The agreeableness. So again, then you're looking at a test that's much more valid to be able to adjust and correct the area that is under most tension in the spine, which that, again, not only do you start to see people feel better, but you start to see other functions improve, such as better mental clarity. They start breathing better because all of these pathways of nerves that are causing pain, these pathways up and down the spinal cord are also carrying messages for internal organ function. So that's why you can adjust someone and not only do they feel better, but oh my gosh, my sinuses just opened up. How many times, especially this time of year, we're going into fall season, we see in the spring season, you adjust someone, it's like, oh my gosh, my sinuses just opened up, or I just started to drain, my ears opened up, I can breathe better, they go home and they can poop better because they're constipated and, all these different internal organ functions improve because we are taking tension off of a system and normalizing tension through that spine. And because it's so intimately related with the spinal cord, which is merely an extension of the brain, carrying messages for all types of body functions throughout, once you start to normalize that function, the body starts to heal the way it's designed to. So that's why that test is so significantly important. So whether you've had an injury in the past and you just don't seem like it's resolving, or whether you have a young child who is in some type of sport, and you think that maybe I better have them assessed because I want to make sure their spine is as strong as possible, because why wouldn't you want to make sure that their spine is developing under a normal, healthy tension rather than an abnormal tension, the subluxation? Because once your body matures with that subluxation in it, then it starts accepting that as normal. And it's not that it can't be corrected, it can be, but it just takes a heck of a lot longer once the body has established the abnormal as its new normal. Okay? Oh, I just used that old term that we hate. But anyway, so I mean that's the advantage of looking at an instability. So if you've been diagnosed or told that you might have an instability, the best way to assess it is looking at this motion X-ray assessment. And again, we're one of the few offices in our region that has it and assesses it in this way, in combination, looking at too much motion or too little motion, and trying to get you, coordinating the best results through adjustments and other, techniques that maybe other healthcare providers use, and being able to coordinate care for the best solution of your health and well-being. So, with that being said, I think I can get off my soapbox now. Every now and again, they let me get up, and then they got to rein me back in. But I hope that was helpful. If any of this resonated with you, if you yourself are seeking help, or seeking help for a family member, especially a child who you think may be developing some sort of abnormal, challenge because of an injury or because of a sport or some sort of activity that they're doing, strongly encourage that you give our office a call or check out our website. And if you're out of the area and still looking for that professional that could do that test, that motion assessment in your area, don't hesitate to reach out, because we know what to look for, and hopefully find someone closer to you. Or you can fly in and see us. We've had people do that too. So, Pittsburgh's a nice place to visit, just not in January.
I was going to say, So come now.
Come now. I was just saying, we're entering the most beautiful time of the year around
Book
here.
your appointments now.
Absolutely love it. So, with that being said, I am Dr. Dan. Thanks for interjecting.
I'm Angela, guys, and thanks for listening, and we will see you next time.
See you in the next one.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.